Good afternoon. This is Dennis Luttrell, Lebanon City Manager, with the latest edition of Lebanon in Depth. The topic for our conversation this afternoon is the opioid crisis. And I'm joined today with some folks that we're going to have a discussion concerning this. And today we are joined by Lynne Goodwin, the Human Services Director for the city. And we are also joined by Susan Thistle, the Executive Director of Headrest, and Chief Richard Mello of the Lebanon Police Department. I'd like to kick it off by asking you, what do you think this crisis is? We see it in the news, we see it in the newspapers. What exactly is this opioid crisis, and how has it manifested itself here in the Valley?
I guess I can start because usually we see a lot of the issues that we're seeing with addiction and heroin and opioids in general through law enforcement contact. And we've been seeing a steady increase in that activity, both from possession, those in possession of various narcotics and heroin and other opiates and opioids. We also see it in the terms of sales and people bringing it into the city and bringing it into the valley to sell and to distribute. And it's certainly, unfortunately, we see it from the overdose perspective as well. We've been fairly fortunate in Lebanon not to have as many deaths as some of the other communities in New Hampshire, such as Manchester and Nashua, but we're certainly seeing our share of problems and overdoses. So from our perspective, we as police officers know how to do kind of the one thing very well, which is the enforcement aspect of it, but certainly doesn't solve the problem. So we're relying on other agencies and service providers to come up and take care of the service and the treatment side of things.
So it's just not heroin. Could it be prescription pills and that type of thing as well? We
see quite a bit of prescription pills. We see quite a bit of prescription narcotics that are in possession being used by people that have contact with us. Most often they don't have a prescription for it. They're taking prescriptions from somebody else. They're stealing them. They're coming into their possession a number of different ways. Very, very rarely do we see them with their own prescription, although a lot of the addiction starts out that way. But it runs the gamut as far as what we're seeing is for drugs, street drugs and prescription drugs.
I heard a couple of statistics last night on the news that I thought were interesting. First, that they estimate 4/5 of the people that are having the addiction problems today as a result of first starting on prescription painkillers. And that, give an idea of the order of magnitude nationally, there's 129 deaths per day now attributed to overdoses of the opioid variety. And that is more than an average day you would have either violent deaths by guns or by accidents in motor vehicles. So it's risen to that kind of a level, unfortunately. Mm-hmm. Sue, do you have anything to add?
Well, I think it's interesting that you started because a lot of times it starts there and then we wind up seeing folks coming into our place.
Can you talk a little bit about what your place is?
Sure. We have 3 different programs. First, we have our 24/7 Crisis Hotline. And the Crisis Hotline services mostly the Upper Valley area, but we also service New England and national. So if a call comes into, we're nationally accredited, so if a call comes into someplace out in the Midwest and they can't handle the call or they're on another line, it'll get funneled to somebody else, and sometimes we're that. Somebody was just telling me they actually got a call from somebody in Bangladesh. I don't know how that happened, but so our Crisis Hotline folks are there 24/7. They're awake 24/7, and they are trained in crisis intervention. So they usually get the call from whoever.
And what's that number?
Well, we have a bunch of numbers that go there, but 448-4400 is our local number. That if there's somebody, I don't know the other ones off the top of my head.
Well,
Sorry.
You have a local one to work
I
from.
should. but
I
the
didn't mean to
local
put you
one.
on the spot, but I wanted to get that right out since
I
you
wish
were
I had
talking
it with
about the
me.
hotline, that we let people know how they can get onto that hotline
Right,
right
good,
away.
good. That's a good idea, yeah. So we get a lot of crisis calls, substance, somebody may be using and want help, and we do a lot of referrals throughout the state, throughout New England, wherever we can try and get somebody into services. We also have an outpatient service, so if somebody's in crisis, we'll get them into outpatient intake that day. So that that person can get help right away, and we can have a live body right there helping them if they need to get to a residential treatment facility or any other kind of crisis services. So in our outpatient services, we have staff who do intensive outpatient, which is 9 hours a week of group and 1 hour a week of individual. They do groups. We do individual if they just want individual counseling, gender-specific groups. We also have a low-intensity residential program. It's a 90-day program, and usually those folks are coming out of a treatment center. So somebody would go into 28 days. They have to be 4 weeks sober and clean before they come into that particular program. So they're coming out of a 28-day program. They may be coming out of jail or prison or drug court folks, or they've been with a counselor for 4 weeks and that counselor will vouch for them, or they've been in our intensive outpatient. A lot of times people can't get into residential treatment because there aren't enough beds. So we'll start them in our intensive outpatient. It's the best we can do, or some of the staff will see them more than, maybe once a day just to make sure they're okay until they can get into the treatment that they need. So
Can we talk a little bit about just how far behind we are lacking in our community and perhaps statewide with regards to supply and demand when it comes to beds and counselors? And
you're not going to want to hear it. But
well,
the
I think
truth
people need to
is
understand just,
that we have
just
the
what we're
highest
facing.
we have the highest level of overdose in the country. At least we did last year. I don't know what the stats are this past year, the year before 14, and we have the least amount of services. So
It's not a good combination.
We're down at the bottom. Like I think we're out of 50, we're 49, 48, something like that. That's a stat that I heard. So, and as I was mentioning earlier, that I had heard at a round table, Annie Custer talked about at one point in New Hampshire we had 650 treatment beds. That's a level of care that folks need. It's 24/7 care. Sometimes people need that care. We used to have 650 beds in New Hampshire, and we have about 100 right now. I know there's a lot of people coming into New Hampshire or people that are here that are trying to expand and make more beds available, but it's not happening right now. I mean, Farnham Center opened a center in Franklin, so there's a few more beds there. There's another place opening up in Effingham, which will have a few more beds there. So they're starting to come. So.
Yeah, I know when I was down in Massachusetts, there was a community that formerly had a state hospital with hundreds of beds.
Yeah.
And they closed down. The state closed them down. And they closed another one over in Taunton in another community, which is where the first real big outbreak of overdoses was occurring in Mass when I was in that neighborhood, not in Taunton, but a neighboring community when this started happening in Massachusetts to frightening degrees that it had gotten to and became a crisis in Massachusetts. But this other community, probably 20 miles away, recently had a for-profit group come in to provide beds and counseling, basically a hospital just for those with addiction.
Yeah.
And that there was such a demand that the private sector was jumping in and
now.
filling in that gap.
Yep.
And you're starting to see that here now as well.
Yep. I keep hearing people say, well, I just spoke with somebody yesterday who said, I've just been hired by this company and I'm a statewide director, and can you sit with me and talk with me? And so, yeah, they're popping up. I've had a lot of phone calls from different people. Yeah.
Not fast enough, though.
No.
You mentioned drug court, and maybe you and the chief could talk a little bit about what that drug court is. Maybe how that has changed an approach about taking people who have an illness and taking a different look at them from a criminal justice standpoint and what they're doing over there.
Very excited about it. Did you want to touch on that?
Yeah, I mean, I can certainly start, and then you can
Okay.
finish up. I mean, the drug court for us, historically, and this goes back to when the war on drugs really started to ramp up in the late 70s and through the 80s, and it created a situation where those with addiction and those with substance abuse problems became more criminalized in our society, and it resulted in a prison boom, prison population boom of people who were being incarcerated solely for their involvement in drugs. In some cases, there are some people who are trafficking large amounts of drugs and certainly adding to this problem, and those are the people we should continue to focus on and target as far as our enforcement efforts. But a lot of the war on drugs was targeting those merely using and in possession, and there's no way to break that cycle. Prison's not going to break that cycle. Being arrested is not going to break that cycle. It's really a treatment and it's a medical need that's going to break that cycle. So the drug court offers a different track, so to speak, rather than being solely focused on punishment and holding people accountable from the jail or the fines or suspended sentences or what have you. It really focuses on recognizing that the causation and the core issue behind it is an addiction or a substance use or abuse type scenario, and more tracks them and focuses on them towards treatment rather than prison and jail. And then hopefully they kind of go down the road to a program that would come into play with the program like Headrest, where they would get the appropriate treatment.
And when I understand it is that program basically would not have you sentenced to actually go to jail, but over a period of somewhere between 18 and 24 months, where you'd be given treatment.
Right.
And in some cases, that treatment actually occur in or out of confinement, but for the most part, they try to do it outside of confinement.
Right. Right. So we see a lot of drug court folks, and sometimes they start in residential and then they go into intensive outpatient and then they continue on in one of our men's groups. We have one men's group, and there's this myth out there that forced treatment doesn't work. I think that needs to be squelched. I think there's a community of folks who say, well, you have to hit bottom. That's not true. You don't have to hit bottom. You don't have to wind up in drug court to get help. There are techniques that therapists and folks use to help people get to that place where they understand that they have an illness and that they need help. And actually, some of these programs are more successful because they have to finish treatment, because they have this jail time or prison time hanging over them. So I think drug court's awesome. I think that, hopefully we're going to be seeing more and more folks going through the drug court system. I know that there's been a lot of push for funding to go that way. So. But they're supervised, they have to do treatment, they actually help them with gym memberships and whatever they need. If they need an apartment, they help them get the apartment. They have a whole team of folks in the court system that help them. It's great. It's really great. Yeah.
Okay. Sometimes people need help when they're having to pay for some of these co-pays that might be involved with going to a counselor or to some sort of outpatient, and maybe they worry about that because how they're going to pay for the rent.
Right.
And maybe Lynne, could you talk a little bit about the programs that the city offers that maybe would offer some
Sure.
folks some assistance?
As part of the General Assistance Program, we recognize that some folks may have medical expenses related to their addiction treatment, and those are allowable expenses that applicants can verify that they pay out of pocket. For example, one of the treatment programs in town charges $65 a week for their weekly group, and insurance doesn't cover that. And so if that's over $200 a month going out of your household for that important component of treatment, we'll take that into account, and if you're short on your rent because of that, you may find that you're eligible for rental assistance. The city does not pay for medication-assisted treatment, so we don't pay for the Suboxone or methadone, but most insurance will, and if folks aren't covered, we try to help them find access to applying for Medicaid.
And what I want to bring out there is a number of resources available. Right. And to really now try to focus a little bit more on what all those resources are. We talked a little bit about our program, but you also would be able to refer people if they came to you with a situation. I know, Chief, you recently have a place where you can dispose of drugs and syringes and so forth installed up at the PD. Maybe we could just talk a little bit more about those types of programs that you have with not only within your own agencies or departments, but that you're aware of as well. We don't have everybody in the community here that's willing and able to assist folks, but maybe we can at least point them in the right directions. And maybe a little bit too about how to recognize that maybe there is an issue, telltale signs that people then maybe need to watch a little closer over a loved one or a family member or a friend, and really see if there's a problem, because intervention earlier on is probably best, I would think.
Which is a good segue into our family workshop, which we will be hosting on March 30th on Church Street. We're at 14 Church Street in Lebanon, and it's at the church across the street from us. And that we'll be able to share a lot of that information and what families can do to help people get help. And one of the things I want to say too is that our place, all of our services, it doesn't matter if they have money or not, we'll take them. That's the benefit of the job that I have, is that I try and make sure we somehow stay alive. And the good news is that the state has been starting to help us with that. So we take people regardless of their ability to pay. And one of the grants I applied for will help with first month and security deposit for some of our folks in the residential program, and we do often send them over to Lynne for services, as well as other places in the community. But telltale signs, some of them would be, money seems to be disappearing, the person isn't going to work, medication is missing, they're hanging out with the wrong people meaning those people who are using drugs. That's a pretty sure sign. When somebody's using an opiate, usually their pupils are really small, and they tend to kind of nod, and you wonder why they look tired all the time when they're not usually a tired person. You can probably think of other ones too, right?
Well, for us...
Can I just interrupt, Chief, one second? For this the session that's coming over at the Church Street address, the time of that, and do people need to call to make reservations in advance? Is there limited seating?
Yes, they do.
Do you expect a lot of people to show up? Because I know some of these sessions that are being offered are filling up very quickly.
Right. Our the person that'll be facilitating that is a MLADAC, a Master Level Licensed Alcohol and Drug Counselor, as well as a mental health counselor, and so he's done family work and is very familiar, over I think 25 years experience. So he'll have a lot to share, and I can't remember the exact time. This is terrible. I think it's 6:30, but you can find out on our by calling 448-4872, and somebody there will pick up the phone and let you know. We do have flyers out there, but yeah, anybody on the hotline who will answer the phone will be able to help them with that.
And what about a website for your organization?
We do have a website, headrest.org. I'm not sure if we've got that up there yet or not, but It is on the 30th. It is at the church across the street from us, and I believe it's at 6:30. I wish I had that information with me.
Okay.
But again, if they call 448-4872, somebody there will be able to help them.
Okay.
Yeah.
Chief? I'm sorry to interrupt you.
No, it's quite all right. Talking about telltale signs, and we tend to see signs that are not necessarily along the same lines as maybe a treatment provider might recognize or see. We tend to see some that are consistent with money going missing. We often run into these situations when we get calls from loved ones that checks are missing or money is missing, medications are missing. And oftentimes what we find is that the family member has been dealing with this for quite a long time, sometimes going on years, and they finally kind of reach that breaking point where they call us, they call the police because they don't know where else to turn, and then we get involved, and sometimes it winds up with someone getting arrested and then put into the system, maybe to the drug court, and getting treatment that way. Other times we're able to intervene and counsel somebody or give someone some advice as to where to turn and where to kind of push their loved one to go. I think what's important to say is that people need to realize that it may never end, or it may be such a prolonged time before the cycle ends. If you don't do something, if you don't try to get them services, the cycle's going to continue. And unfortunately, there are times that the person will actually die because of an overdose or because they continue with the drug addiction. So, that's our contact. That's usually the telltale signs that we see. It's usually that of a family member or friend, and sometimes it's not any of those. Sometimes it's burglaries, and unfortunately, people with addictions will do things that customarily they wouldn't do, and robberies, burglaries, thefts, things of that nature. So that's how it comes into our realm. But as far as the services that we can provide, obviously we're not treatment providers, we're not counselors, we don't have that expertise. What we try to do is provide some services that might be helpful. The prescription drug drop box in our lobby. I had an elderly woman today who showed up for the first time, and I just happened to be outside of the station, and she said, "Can I drop my prescriptions here?" I said, "Absolutely." And she had a big bag full that she no longer needed, and she went in and she dropped them off. So word is getting out there. We recently, through the efforts of Lieutenant Matt Isham and partnered with APD, put a syringe box in our lobby as well, so people who have syringes hanging around, whether because of a diabetic issue or maybe someone who's become clean and now has syringes, they can anonymously drop them off in our lobby, and then APD does take them and dispose of them. So, we try to provide those services. Then we try to have partnerships with organizations like SUES and Headrest and All Together and Push and some of those organizations that allow us to have our hands in different places in the community, including the schools and some of the programs and the forums that we can put on. So we try to attack it from the best way we know how, which is education, getting information out, and then we let the treatment and the service providers, do what they do best.
Lynn, I understand from our discussion the other day that there's a number maybe that or a website that people can go to that would list all these different organizations that are available to them for assistance along these lines?
Yeah, NewHampshireTreatment.org is a wonderful website where you can plug in your zip code, and it'll bring up a list of all of the different treatment options in your area with a nice breakdown of what each provides and what insurances they take and other out-of-pocket expenses. Headrest is on there, as well as all of the addiction treatment programs that I'm aware of in the Lebanon area. So,
could you repeat that web address one more time?
NewHampshireTreatment.org.
Thank you. I understand there's some good news, finally, that there's a bill that was passed in the Senate last night.
Yeah, very excited.
94-1. And I don't remember the last time a piece of legislation got through the Senate on a bipartisan basis. But this one is for $600 million to be given to states, and I hope nonprofits are included as well.
I hope so.
And it's for education, treatment, and overall trying to reduce the death rate from ODs. To be money for police and fire departments in there as well. So I don't know what the House is going to do with it, but certainly bringing some more resources to bear would be very, very helpful.
Right, we also have Medicaid Expansion passed as well, so a lot of people are, that when they started Medicaid, the SUD benefit, the substance use disorder benefit, they only started with new people.
Yeah.
So now all the people who didn't have it now will have it, and I believe we're agreeing that we're going to continue to fund substance use disorders. So that was something we were a little nervous about, but it sounds like things are starting to take place, but again, still we don't have the funding yet.
Right.
So we just do the best we can, and you know, we've asked many people. You know, people donate to us. We've been asking for grants. You know, we have an amazing board who, you know, they're on top of helping us all the time. So they're out trying to raise money, and we have another event. Mud Season Madness is the 30th of April. And the board is putting that, you know, they do most of the work for that. So we want people to get help, regardless of their ability to pay. So we're going to keep giving the services, regardless of whether people can pay. So if they don't have that benefit yet, we'll help them try and get it, and you know, help provide the services that we can without any questions asked. So
That's great.
yeah.
Well, you know, unfortunately, it's if someone in the Valley doesn't know someone who's directly been impacted by this crisis, a family member, a friend of a friend, it may be, unfortunately, only a matter of time before they do. So for those that are listening, there is help available. There are agencies out there. The city is also here. And if you do know someone who needs help, encourage them to reach out to any and all of us. And if you do start to see that there are telltale signs that maybe a friend or a family member is starting to go down that path, please let them know that there is help available with these various agencies and city departments that will be there for them. And anything else you want to be able to let our viewers know about other additional avenues of assistance that might be out there that we haven't already covered?
I think I just like to add from a police department standpoint that our officers make contact with people each and every day that are addicted to drugs in one form or another, whether through a call for service, a motor vehicle stop, an arrest. There's not a day that goes by that we're not seeing it, and I'm sure the same is for Sue and the same is for Lynne. But there is a number of different moving parts in this problem, and one of those is that there are people who are taking advantage of people who are addicted by bringing large amounts of drugs into our community in the Upper Valley. Mm-hmm. And I would just ask that, there's many occasions that we see neighborhoods and people and community members who say, I've seen something strange, or I know of this information. I didn't want to say anything. I just asked them to reach out even anonymously to let us know. Because there's certainly trying to help those who are addicted is a primary focus, but we also, as a police department, focus on the people who are continuing the cycle by bringing in drugs, continuing to sell drugs, and we certainly want to continue to focus our enforcement efforts on them.
So it's a matter of help us help you.
Yeah, absolutely.
Right. Okay. Well, again, I'd like to thank the viewers for tuning in and learning more about the opioid crisis and those agencies and city departments that are available for you and your friends and family members to reach out to in this particular time of need. And I would once again encourage you to do so as quickly as soon as possible, because getting involved early is very important to recovery. Thank you.